and knowledge management. So we're excited to welcome you to today's webinar. I want to go ahead and note that we have interpretation available. So we have interpretation in French today. If you'd like to go ahead, you can click interpretation in your Zoom toolbar and select English or French. So cliquez sur l'interprétation dans votre barre des outils de Zoom et sélectionnez la langue que vous souhaitez attendre.
English. English.
So I think if you're not speaking right now, if you can go ahead and mute, and we'll just give people a minute to join or so. Great. Next slide. So as I mentioned, this webinar is being organized by the Hygiene Promotion in Emergencies Technical Working Group, and I'm really excited that we have a wide range of presenters from different contexts and experiences today. We'll kick off today's webinar with a presentation by Johannes, who is the network coordinator at the German WASH Network and the lead of the Global WASH Cluster Technical Working Group on cash and markers. Following this, we will jump to the Red Cross and Red Crescent movement, where we'll hear from Alexander about global resources that the movement has available, as well as a deep dive into Nepal through a case study by Amar, the Deputy Director of the Nepal Red Cross Society. We'll then go to hear from Diego, who is the leader of innovation with SADO. So we'll hear a private sector perspective. We'll then move over to Nigeria, where we'll hear from Timothy at CRS, who is a hygiene promotion and community mobilization team lead, and also leads the hygiene promotion technical working group in Nigeria. Finally, we'll end up with RIPA North, which is a project in Ethiopia, where we'll hear about menstrual hygiene and private sector engagement in Ethiopia and learn from how we can work across the humanitarian development peace nexus. So we have a full agenda today with a lot of great experiences. And so I ask you to put your questions in the Q&A box throughout the presentation so that each of the presenters can respond directly, and we can answer those questions as we move along. So thanks again, everyone, for joining. I'll now turn it over to Johannes to kick us off.
Okay, thank you very much, Nicole, for hosting this webinar, organizing this webinar, and inviting me. It's an interesting collaboration, as this is a webinar of the Hygiene Technical Working Group of the Global WASH Cluster, and I'm now representing a different technical working group, the one on cash and markets, which I'm the lead of since about 2020. As you can see here on the slide, we have worked on different resources over the past years, and there is a quite extensive guidance available on market-based programming, which you will find also in different languages. And this webinar also builds on a series of webinars, which were also supported by the Pro-WASH project and Nicole, on which you will find the recordings in the presentation. Of course, share the links. So yeah, why working through markets? I mean, you all maybe know that working through markets, with markets, cash and voucher assistance, for example, is often associated with more beneficiary choice or beneficiary preference, beneficiary dignity. We speak often of opportunities like there is efficiency, scalability, or more effectiveness possible in programming. So I would like to, in the few minutes I have here, to speak a bit on why are we doing this, and not only from this point of view of being an advocate for cash in markets, but also from the wash sector or hygiene sector perspective. Next slide, please. This slide shows a causal framework which we have developed, and this was developed actually to be the basis for an evidence review on market-based programming practices in the wash sector, including hygiene, of course. And it is now not important to go through the full diagram here or framework, but you will realize that there is always the opportunity to work with the market, or the supply side, the people, the vendors, the wholesalers, etc., and the household. So the beneficiaries, or the demand side, you can call it, on the other side. And we have a range of different modalities, ranging from supporting the markets to really work on the environment of the markets, the regulations, etc., but also to work more on the demand side, like by, for example, distributing cash to people or providing vouchers for jerry cans, soap, hygiene items, etc. But then also strengthening demand, for example, through marketing, social marketing, hygiene marketing. An example would be marketing for chlorine products, or for soap, or the introduction of menstrual hygiene products, for example. But here, the most important thing, I think, on the causal framework is actually that from a wash sector perspective, what are the outcomes, or the outputs or outcomes we want to see? And here we realize that a wash outcome, like the reduced wash-related morbidity or mortality we want to achieve in an emergency, that this will only be possible if people have access, if the products are available, if they are at the right quality needed, if people are aware on how to use them, where to get them, and finally, really to use them in the right way. And this all is what we want to achieve, and it is questionable whether we can achieve this just by giving out cash to people or a voucher. So working through markets or market modalities are usually embedded in larger responses, covering different modalities. And one important aspect of market-based programming is, of course, that we want to contribute to resilience, that we want to strengthen the local system. Next slide, please. This is just to show you that we produced this evidence review and that you find a report on hygiene in this. There are also the other subsectors, and I will share with you the link in the chat a bit later. Next slide, please. And with this study, we found that in the hygiene sector, market-based programming and also cash is really already kind of a standard practice, is feasible, that it is usually the preferred choice of assistance for the people, and that there are definitely positive effects on access and availability, and that this kind of interventions, like, for example, cash or vouchers, are usually combined with behavior change communication and other modalities. Next slide, please. And here you see a bit an overview of the emerging evidence. So from the more rigorous studies we found, and you see that these are not as many as we would wish for, we saw mostly on the outcome level positive effects on the availability, the access, and quality. It is more complex to find out or get evidence on the question, Are people really aware, or does it strengthen their awareness? Do they use the products in the right way? And there are rarely effects kind of documented or evaluated on health. So the real kind of impacts we want to achieve. Next slide. I'm coming back to the first slide. So it is important, and the webinar hopefully gives you a lot of inspiration and good examples on how to integrate market-based programming in your regular wash or hygiene programming. And here for this, I really want to recommend to you the guidance. It goes through the whole program cycle, through all the different steps as you find it here on the slide. And there is also a training available from the Global Wash Cluster, which will be implemented every year in different regions. And I will share also the link to that. And yeah, wish you good fun with all the other speakers and great insights. Thank you for listening. Happy to receive your questions.
Yeah, great. Thank you so much for that overview and really appreciate it. And please do drop questions for Johannes in the Q&A function. We'll now go to the next slide and move to Alexander and Amar, who will speak to us about the Global Red Cross Red Crescent Cash and Wash Technical Working Group.
Hello, my name is Alexander from the Austrian Red Cross, and I am presenting on behalf of the Global Red Cross and Red Crescent Movement's Cash and Wash Technical Working Group. Yeah, as the name already says, it's a Red Cross internal thing, but we've also basically put all our stuff on the website for download. And the objectives in establishing this technical working group is to infuse the knowledge, also the things that Johannes was just talking about, the manuals that he was talking about, into the wider Red Cross and Red Crescent movement, with the idea that as cash voucher assistance and more broadly speaking market-based programming are getting more and more dominance or more and more weight in overall humanitarian settings, and especially also, of course, also for the Red Cross and Red Crescent movement, we felt that the wash sector in the Red Cross at least is still lagging behind, and that's why we established this technical working group to properly disseminate the evidence within the Red Cross and Red Crescent movement, and to find out what the Red Cross and Red Crescent movement partners are already doing. So there's, of course, it's a big family with a lot of things, with a lot of members, a lot of people involved, and very often, of course, in this kind of very big organizations, the left hand doesn't know what the right hand is doing. And so we also had the idea of properly just documenting things that we might already be doing in terms of market-based programming and cash and voucher for wash. Exactly, supporting our partners with guidance and trainings. That was also something that we wanted to do, and then also stay involved with in the global discourse, and chipping into, for instance, the TwiG that Johannes was just presenting. Currently, the structure is changing a little bit because it depends a lot on who is from the Red Cross movement has time to dedicate to this technical working group. It's all voluntary on top of all our work. So sometimes we've got quite a good membership, and then we have got years where we really struggle to bring together a meaningful group of people. Currently, we have got 3 work streams that are working on dedicated topics. One work stream is on knowledge sharing, as I said, gathering evidence or at least examples from within the Red Cross movement and turning them into case studies, and then disseminating them within the Red Cross and Red Crescent movement. One work stream working on guidelines, but especially on trainings. So we support a couple of our partners in doing their own market-based wash trainings based on the material that also Johannes was referring to. So the training package was developed by by the TwiG that Johannes was presenting, and we basically use a lot of those materials for our own internal trainings. And then yeah, we have a separate work stream on partnerships and implementation, and also communication. As I said, the members are from the whole Red Cross, Red Crescent movement. So it's national societies, it's the IFRC. At some point, we also had ICRC present. At the moment, we don't have anyone from ICRC, but that's, as I said, it's subject to change. We try for good geographical coverage, but well, that's not easy. And we include not only WASH actors, but also we also include cash people from the Red Cross and Red Crescent movement. So yeah, it's a mix of different interests, different geographical focuses, and yeah. As I said, we have got a website where we put all our documents. The link is down here, and I think yeah, it's already in the chat box. Next slide, please. And on the website, you will find a lot of stuff that Johannes was already presenting. We just linked it there, so there are a lot of links. But what I particularly want to point out is some tools that were developed actually by the Red Cross that might be useful for market-based programming, which is a very commonly used tool is the RAM, the Rapid Assessment of Markets. That is a tool that was developed by IFRC and ICRC, and it's a hands-on manual how to do rapid market assessments in crisis situations. Then there's another one, Market Analysis Guidance. That's another tool that's more elaborate, not that rapid, for more stable situations or more long-term interventions. And then also you'll find our MHM guidance documents, which include a section on MHM and CVA and cash and voucher assistance, where you've got also very simplified market assessment tools and very simplified workflows for cash and voucher assistance in a framework of MHM. And yeah, with this, I would like to end just with a short note what you hear in a few seconds time. We thought that one of the best things to motivate our Red Cross and Red Crescent movement partners to get engaged with market-based programming is to start off with a market assessment, especially a pre-crisis market assessment, because then you don't have to worry about the ongoing crisis, but when the situation is stable, do a pre-crisis market assessment. And that's exactly what the Nepal Red Cross did, not once, but already a couple of times. And you will hear some more details from my colleague Amar. Over to Amar.
Do you want to start the video, Lauren?
Hi everyone, this is Amarmani Paudel, working as a Deputy Director in WAS Division of Nepal Red Cross Society headquarters. Today I am going to share you the process and finding a pre-crisis market assessment that Nepal Red Cross Society has conducted with the support from the Austrian Red Cross and IFRC. Actually, Nepal Red Cross Society conducted two water and sanitation hygiene pre-crisis market assessment considering emergency context of flood and landslide. In the process of assessment, two scenarios have chosen. For example, in the case of landslide in Gandaki province, typical scenario has taken seasonal annual landslide of 2020 and as an extreme crisis scenario taken 2021 landslide. Based on the scenarios, focus group discussion, key informant interview, observation, etc., tools were used to collect information and data from communities up to manufacturer level of particular market. To collect the required information and data in the field, 4 PCMA groups were formed. Each group has responsible to collect data of at least 2 critical markets. The group visited to the most affected areas, its retailer market, its wholesaler markets, and manufacturer. In each group, 4 persons such as team leader, PMER, CVA volunteer, and district chapter translator volunteer were teamed up for the assignment. Thank you. Based on the people preferences, criticality of item in the crisis situation, losses of items in the disaster, and organization mandates, it were chosen 7 water and sanitation items as a must require item, including a service that is technician service also for the chosen for the toilet construction as a critical market. Those critical market systems are bathing, laundry soap, MHM pad, chlorine, ORS, bucket, and toilet items. In the whole process of WAS PCMA, preparation and uploading of questionnaire set in Kobo Connect were completed at central level, participating all PCMA members. Each team conducted district level WAS PCMA workshop in each district and collected data of particular markets, discussed with affected people, and observing the affected areas. After data collections, all 4 teams joined together at province headquarters to drafting the report through the rights of process. Then all 4 teams, taking all collected information and data with them, discussed rigorously in 2 days rights of the finalizing process of report were moved forward. Here are some PCMA activities and photos as a glimpse. Now I am going to share you some major findings of those was PCMA. One of the findings is during the assessment time we found that manufacturer and wholesaler were simply affected, and the most affected market actors are retailer and consumer in the both cases, in the landslide case and then flood case. While the road damaged and affected during the crisis time, we have to think about the porter service as a mandatory service in the case of mountain landslide. Likewise, based on the data, we found that some manufacturer of laundry soap and menstruation pad, they are local manufacturer, and then during the crisis, the supply chain is not much affected. If we observe the market chain flow from retailer to wholesaler, it seems diverse directions in our case. However, if we try to deep down the information about the direction of manufacture, in our case, most of the manufacturers are southern part of the country and then transborder to India. And based on the data and informations, the price fluctuation of these commodities items was in minimum 5 to 10% in between during the normal and crisis time, while roadblocks it goes 15% increment in price because the porter service will be on that situations. Chlorine items were available in only few wholesaler and water user committees, and it is not easily available. The reason is we have to depend this item transborder supply chain. However, during the assessment, we found that the chlorine tablet and sachets were found in some touristic routes. Another recommendation is the branding. The most of the brand of chosen items is Nepali brand, and also some are Indian brand like chlorine. And limited international NGOs are working in those areas as a disaster response, but they have not vast stock capacity. And another recommendation is we talked about the preferences of cash to the community people, and community people said that they preferred cash of most, but they said that while transportation affected, they have to go in kind or both mixed modality. And at the last, we also draw one recommendation that is related to the Nepal Red Cross societies. We found that based on the district and the headquarter people's perceptions and interviewed, it need to capacitate Nepal Red Cross human resource and create policy and system environment to implement the effective CVA programs. And this type of PCA assessment also increase the capacity of staff and volunteer of Nepal Red Cross Society. Thank you all for your time and listening. Thank you very much.
Great, thank you so much. And we have Amal on the phone as well. So any questions you might have, I see there's one from Roger in the chat box and one coming in the Q&A. So presenters, if I can ask you to go ahead and respond to those, but others as well, please go ahead and ask questions as we move to the next presenter. So I'm pleased now to present Daiga, who will be joining us and speaking from more of the private sector angle, as we've heard from a couple of implementers so far, and now we'll move to markets and private sector engagement. Daigo is the leader of innovation at SATO. Lauren, can you share your presentation? Perfect.
Yeah, thank you for having me. My name is Daigo Ishiyama. I'm the leader of innovation at SATO. And today I would like to briefly introduce you to who SATO is, what we do, what we've done, and what we did to develop our first hand washing station called the SATO Tap at the start of the COVID-19 pandemic, and an example of the work we do in humanitarian settings. Next slide, please. So SATO is a brand of Lixil. And as a brand, SATO has the purpose to empower people everywhere to live a better life and enjoy a brighter future through innovative and affordable sanitation and hygiene solutions. And as a company, Lixil has a goal of improving 100 million lives by 2025. Next slide, please. So I do have quite a few slides, but my understanding is the slides are going to be sent, the links to the slides will be sent out, so don't worry about reading every text on the slide. Lixil, you might know Lixil brands from global brands like Growa or American Standard, but SATO caters to the needs of the very basic sanitation and hygiene solutions for the communities. Next slide, please. Yeah, so this is a brief history of how SATO started and what we've done. We started in 2012 through the Bill and Melinda Gates Foundation Reinvent the Toilet Challenge program, and we started selling the first SATO pans in Bangladesh in 2013. And the other thing I want to note is that we started this partnership with UNICEF called the Make a Splash in 2018. And in 2020, we developed the first hand washing station called the SATO Tap, which we're going to cover today. Next slide, please. So today, as of April of last year, 2023, our numbers were, we've shipped products to 45 countries. And we've reached 45 million people with improved access to sanitation and hygiene. So that's what we've done so far. And next slide, please. So in 2020, we were hit, as we all know, with the COVID-19 pandemic. Next slide, please. So the recommendation to combat the spread of the disease, as you're all aware, was to wear a mask, social distancing, and frequent hand washing. So we did a lot of research, and the hand washing is really an effective and one of the cheapest way to combat the spread of the virus. And a lot of households lack access to the proper hand washing facility. And the access to the facilities were the key drivers, one of the key drivers for promoting hand washing behavior. Next slide, please. So in the end, what we came up with is this Sato Tap product, which is this blue hand washing station. You set a PET bottle or a plastic bottle that's already in the communities as used plastic bottles. You fill that and you use that as a reservoir, and it puts out enough water for the hand washing. So the key benefits are it allows users to do a proper hand washing with as little as 100 milliliters of water. It's easy and affordable to use and set up. And the small footprint of the product allows for easy access anywhere you want to place the hand washing station. There's really minimal moving parts, so it would last a long time. And again, the use of existing used plastic bottles, it gives the second life to the used bottle, so it contributes to reducing the plastic waste. Next slide, please. So, what were the timelines that we developed and produced the Sato Tap during the 2020 to 2021 COVID lockdown? So in March of 2020, at least in the US, that's when this COVID was spreading and a lot of the townships went into lockdown. And I contracted COVID in early March of 2020. So really, I got really sick. And but once I got better, we started doing research within the Sato team, but we had a lot of inputs from the partners. And here's when, where UNICEF, partners like UNICEF provided a lot of inputs to what the hand washing, solution can be. And that was really helpful, especially during the lockdown, to hear those partner inputs. So, but the research started in March, and then once I got better, I started working on the product development. And that Easter weekend, I remember I made the first prototype. I went to Home Depot, got some supplies, built the first prototype in Easter. And I went through concept 1 through 5 in a matter of 5.5 weeks. And then on May 23rd, I froze the design. Early June, we filed IP, and then June 8th, we did a press release of this new product. And during that time, we were doing a mold making of the final design. End of July, I got the first samples from the mold maker, and I started testing the samples in early August. And once the samples were tested and they were good, we started sending them out to partners, these internal team members. We sent some to Navajo Nation, which were in dire need of hand washing at the time. So we started sending samples in mid-August. And I think it was in September, we started working on the framework of the bigger field research in South Asia and East Africa with UNICEF and M-Water in East Africa and South Asia with UNICEF. But this is really where this established partnership with UNICEF really came in play, and it was really helpful to carry out these research. At the same time, we needed to understand the global bottle shape, so we started running a survey on what products what bottle shapes are there and whether that would work. And predominantly the bottle shapes that were being commonly sold worked with the Sato Tap. The field test results, the drafts came in around early January of next year. So if you're interested, please scan these codes and you have access to those reports from East Africa and South Asia. And one of the findings was from these reports was the dispense flow rate out of the tap. So immediately after the reports came out, we made that change on the design. to put out a little more water flow for the users to accomplish proper hand washing in less time. But yeah, that's the timeline. Within a year, we went from concept research to concept generation to product development and having actual product. Next slide, please. So with that, that was for the pandemic crisis response, but we started growing these crises, the humanitarian portfolio, and we've recently launched the slab and the pit liner in addition to the Sato tap, and we're working on the flatback superstructure, the urine diversion toilet. Those we have proof of concept models that we're ready to make molds. So they'll be introduced soon. We have a sealed pit system, and we're working on the tiger worm digester kit. Next slide, please. So I'm currently in Kenya. I'm traveling, and I was in Kakuma, a refugee camp earlier this week. And this is one example of the work we've been doing in the refugee camps. With Peace Winds, we've developed the entrepreneurs to sell Sato products in the Duka Safi shops to provide access to the community members to proper hand washing and sanitation. So if you're interested, please scan this code and read the full story. Thank you. Next slide, please. And then yes, please reach out to us. We're always looking for partners to work with, and we're always ready to talk about what we can do and how we can collaborate. So please reach out to us. Thank you.
Great. Thank you so much. Yeah, really appreciate it. And please do ask questions using the chat box or in the Q&A if you have any questions for Sato. Thanks so much. So now let's move to the next presentation. We're moving over to Timothy, who's with Catholic Relief Services in Nigeria. Over to you, Timothy.
All right. Good morning, afternoon, and evening, depending on what part of the world you are. I just want to take us through some of the work that we did in the Northeast through Catholic Relief Service support to the community. Just to say that for the past 10 years and above, the conflict in the Northeast by Boko Haram and ISWAP, displays a lot of families. And then, of course, people lost their livelihoods, and of course, there were so many loss of lives. And that site was completely devastated by the crisis. And so other partners were available, but CRS came in the year 2016 to support the emergency response in the Northeast with funding from various partners, including BHA, and we were actually providing food assistance, livelihood, wash, agric intervention, and nutrition support, among other things. And of course, CRS has supported the wash sector in the Northeast Nigeria in the capacity building of partners, especially local partners and other international partners, and drafting and reviews of documents that supports the work that we do in the Northeast. Next slide. Now diving into the e-voucher programming and working with the private sectors to support hygiene within the Northeast Nigeria. Johannes have actually laid the foundation for the processes which you would take to do e-voucher programming, which I wouldn't want to bore us with that for fear of redundancy and of course the time that I have in my hands. So I will just dive into the platform that we're using and how we're using it, and the outcome of the activities that we've done through e-voucher, market-based programming through e-voucher. What we do after the assessment of the market, as already mentioned by Johannes, is to also look at the vendors and of course do a pre-qualification training and provide them with devices that is linked to a platform that is known as Red Rose. And then we also would do a market survey, just like he has mentioned, assessment there, and then find out the kinds of markets that we have, what we have in the market. Can it also take care of the needs of the beneficiaries who were earlier assessed through the rapid hygiene promotion assessment for NFIs, and this is checked vis-a-vis what is available in the market. And of course, then we would now register the beneficiaries who are going to be selected based on some selection criteria that the organization have set, including the community members or the project participants, as it were, looking at hunger score, looking at disability, looking at child-headed households, among other criteria that I use in order to select beneficiaries, because as we already know, most times it may not be everybody that would need some of the items that is needed in the in those areas. And so when they are selected, the beneficiaries are selected, vendors are already trained, market is ready, the beneficiaries are actually grouped according to communities, and they go to the vendor's shop. And since the market is around the corner within those communities, they actually go there to redeem the items based on what is needed in the household, rather than just any item at all. Because as I said earlier, we look at what they need based on the assessment, and then of course we now look at what is in the market, and based on the availability of the items that are needed, they go to redeem. Their wallets actually is in a card form, as you could see in the picture below. And then this Red Rose card, as it were, has the capacity of having over 20 wallets. And so for the beneficiaries, they go with this to the vendor's shop, where their biometric is actually hidden in the platform, and it's easily seen. So even if the card is stolen, nobody is able to use it, because we use biometrics to identify beneficiaries and the amount of money that is in the wallet, and the items are already in the platform, and they select and negotiate for price of items, and so they have the ability to get what they want at a good price within those markets. So CRS has been, from 2023 to date, distributed over 15,000 over 15,000 households, which is about 9,000 individuals, with hygiene kits through this platform. That is just within the past 1.5 years or thereabout. Next slide. And so how do we engage the private sector? It's basically just like I said, the vendors, the shop owners, of course, are private sector guys. They are not basically beneficiaries, as it were, and so they come in. So what we do with them to ensure that they remain in business is to ensure the registration with either, in Nigeria is called Corporate Affairs Commission, which is a body that you must register with to have your business registered with to operate. And then, of course, there is also the registration with Standard Organizations of Nigeria. And it may interest you to also note that some of these businessmen do not have bank accounts. So CRS actually built their capacity and supported them to also have that, in order to reduce the risks of handling cash during their businesses. And then, of course, we provided the vendors with the opportunity for e-learning, because it's an e-platform, and so they are trained on using e-platforms in doing business. And of course, it also provided an opportunity for youths to be employed during any of the cycles of NFI's distribution, because the vendors will need people that will support him to work, and so youths that are idle are engaged, and so it provides an avenue that also these youths can also find some form of livelihood. And also the vendors through this engagement are also able to expand their shops and of course their income increase. And so some of them, as I speak now, have extension of their shops in other locations within communities that we work. And of course, this also, the engagement through e-platform also reduces the risks of the vendors handling large volume of cash because the beneficiaries do not go to the shop with cash or cash are carried around. But all this is done through e-platform, and then of course monies is transferred to them after the sales and distribution straight to their account, so they do not have to, handle cash. So the risk of cash for the private sector guys is actually handling cash, risks of handling cash, that is, for these private sector guys is actually taken off them to reduce any challenge. Next slide, please. And so some of the lessons that we learned through the voucher system is it provides an avenue for choice for beneficiaries. In time past, hygiene kits are just bought and then dumped on beneficiaries, if I might use the words, just given to beneficiaries without whether they need those items or not. But these particular methods allow for choice of hygiene items by beneficiaries in the shops that they go into to select. And then it also helps in preventing the reselling of items that they do not need. And of course, as I said, it also reduces the risks of beneficiaries carrying cash. That risk is transferred to vendors. It also gives the opportunity for communities to shop at particular days, because only those that are shopping in a particular day wallets are actually uploaded with cash per se that will be withdrawn at the shop through the e-system. Next slide. And so there's actually, while we're doing this programming, we looked at the menstrual hygiene management component, which we felt we could look at how we can work through the protection sector, wash sector, and then of course the livelihood sector to find a way of having blend this together. Now we are able to through one of our projects provide safe spaces where trainings goes on for artisans, tailors who are trained, and they provide services for communities by fixing their fabrics and the rest of them. And so through that, we thought it wise to train them on how to locally produce the reusable parts that can be obtained from those safe spaces. So the leaders of the safe spaces open a bank account in the name of the safe space, and of course the safe space is registered as vendor. This is for sustainability. So parts that are produced within this safe space, instead for the beneficiaries or to go to the market to buy these items, they go to these safe spaces and make available their cards, and then they procure the parts through that. And then by so doing, parts that are produced are sold through e-voucher system, of course, so you could see the collaboration between livelihoods, menstrual hygiene management, and of course hygiene itself as it were. So this is what we're doing now, and it's very interesting, and we see results because parts that are being procured, money is used to run those safe spaces apart from other livelihood activities that is going on within those safe spaces. Next slide. All right, thank you very much. That is just about it. Sharing our experience from CRS with you in the Northeast.
Great. Thank you so much, Timothy. And please do put your questions for Timothy in the Q&A box. I'd like to now introduce our final presenters for today. They are joining us from the resilience and pastoral areas, RIPA North. Over to you for market-based solutions for sustainable access to hygiene and sanitation products.
Hello, everyone. Thank you so much. So
My name is Jalan Nirpasa. I am the Senior Market System Development Advisor for the Diversified Economic Opportunity Component at Mercy Corps Repreneurs Program. I am here with my colleague Zaman. So we are going to present from Repreneurs side. In the next 10 minutes, I will walk you through the first 4 slides, and the next slides will be presented by my colleague Zaman. If you guys are willing to learn about what Repreneurs is doing in Ethiopia, Zaman already put the link, our website link on the chat box, so you can go ahead and click on the link and learn about what the work we are doing here. So I don't want to waste our time giving the background about RIPA. So I will jump into the presentation. So next slide, please. So to give you a little bit background about the context, we are implementing this program in the lowland part of the country, where displacement due to conflict, recurrent drought, and disease outbreak is common. So in this case, households can't get basic needs, and they give a priority to purchase food items than non-food items. And infrastructure is also another problem. So most of the locations we are operating has a limited access to different infrastructures, such as health facilities, roads for transportation, schools, and some retailer shops are not available in the area. And also there are limited or non-suppliers for the non-reusable sanitary parts. So let alone the reusable one, it's difficult for women and girls to access the use and throw one. So because of the remoteness of the area. So affordability is also another issue for the women and girls. It's difficult for them to access these reusable sanitary parts because of the price. So because of this challenge, women and girls can't attend social gatherings and events during their menstrual cycle period. Girls are forced to be absent from schools and other relevant events. And also disposal of these non-reusable sanitary parts is also another problem for the both environment and for the girls. Psychologically, there is a shaming in the community related to this. And even humanitarian actors who are willing to intervene in this area also are challenged in accessing reusable sanitary parts in the area. Next slide, please. So to address this problem, Repreneurs started implementing the following activities. We've started with, conducting an assessment. During the assessment, we've understood that our target women and girls can't access dignity kits that are affordable in cost, and then there is also reusable sanitary pads that are accessible only for the central markets. And we have also, secondly, that we've sit together and design the response analysis where we start engaging government stakeholders, the women and children, health and education team members, and we choose market-based solution to work with local producers. And we've identified potential market actors, private sector actors who can collaborate with us and introduce the last mile agents-based sales at this stage. So then we've designed the implementation, which has a co-creation, a detailed co-creation with the private sectors, such as the producers, trainers, and raw material suppliers to agree on a business model. And Mercy Corps also provide a competitive in-kind startup grant at this stage, and we have also facilitated a linkage and support between market actors, which are producers, the trainers, raw material suppliers, and the last mile agents. And then an ongoing monitoring and support were in the entire implementation. So we were engaging the trainers for the quality assurance check of the produced reusable sanitary parts, and we were monitoring the entire process. Next slide, please. As I mentioned earlier, we try to show the indication of the linkage of the market actors whom we engage in this process. So in addition to the one I already mentioned, we also have the financial institutions as a sustainable source for financial resource for the market actors, and the pharmacies as a potential future buyers, and humanitarian organizations potential adopters of the approach. LNGOs located in the area as a potential adapters of the approach and also future buyers, and training companies for sustainable technical training and capacity building. Next slide, please. So accordingly, from the supply side, Mercy Corps intervened in training 14 local producers. 50% of them are women located in the area, in our implementation area. We've identified them, give them a consecutive 10 days training. And based on the MSC call for application, 5 of them are producers were selected for the in-kind grant support started, and they started production. We've also created a market linkage with input supplier based in Addis at the central market. And also we have facilitated a linkage between last mile agents. From the demand side, Mercy Corps facilitated a demonstration on the utilization, cleaning and disposal of the dignity kits for the community. And also we've purchased around 3,550 of the dignity kits on a voucher basis. On the market environment, we've promoted the business model to stakeholders and also actors to support the market environment. If I say this, my colleague Zaman will walk us through the remaining slides. Over to you, Zaman. Thank you.
Thank you, Jalani. As my colleague already mentioned, you know, the intervention has been clearly addressed, highlighted. So for this one, I will take through you, through the key achievements we have accomplished so far and the challenges and the way forward. So actually, Jalani has already mentioned the key achievements, and I'm here to just boldly highlight some of the achievements we made. So the first one is, as she mentioned, we trained local producers, and those local producers have been linked with the last mile agents to increase the accessibility of the product in the rural areas, especially far, locations where access to basic needs is not like easy. So once we did that training and linked with the last mile agents, those local producers started the production of the reusable sanitary pad after they received startup grant support from Mercy Corps. And following that, we tried to make a quality assurance check with all the local producers to make sure that the product has the right quality that will be used at the end users for women and adolescent girls. Once we did that, we provided the reusable sanitary pad and 4 reusable sanitary pad and 2 pants for each women and adolescent girls. And from this, almost 6,000 program participants benefited from this support. And the other outcome level indicators, like one, they saw the business model and the benefit of this business model. Government and other development partners adopted or tried to follow our footsteps to adopt the business model and expand it to the non-RIPA intervention areas. So far, from those, from Mercy Corps and from the other implementing partners and government, those local producers made a revenue of more than 1.7 million Ethiopian birr, which is equivalent to close to $32,000, which is also a big improvement or promising result. And the other thing is, in addition to producing and distributing these sanitary pad products, those local reusable sanitary pad producers who have been trained by Mercy Corps have been used as a resource person or a trainer for other local producers with the support of UNICEF and other government actors. Next slide, please. So some of the challenges we have been encountered is the first one is access to raw materials, because we have only limited number of raw material suppliers from the central market, and this is not enough for the local producers. So this is one big challenge. and limited financial capacity from the local producers to expand and scale up their business is another big challenge. And getting reliable last mile agents for the local producers is another biggest challenge, because those local producers are based in a zonal town and in some Warada town or district town, and those qabalis are far from the communities. I mean, the communities are far from the producers, and accessing those products is a big deal. And less confidence among the local suppliers on the profitability of the business, because we have been, as Jalani mentioned, we trained more than, almost 14 local reusable sanitary pad producers, and only half of those producers applied for the call for application Mercy Corps as announced for the startup grant. And less awareness from the community side on the benefit of the reusable sanitary pad is another challenge. And finally, less purchasing power of the household, especially during the critical emergency situation, is another big challenge. Next slide, please. And the way forward, based on those challenges, what we put as a way forward is to improve, to scale up our support in terms of supporting local producers to connect with the financial institutions so that they can get loan and can be able to, expand their business and improve, increase their production, so that women and adolescent girls in rural communities can get the product easily. Strengthening the market linkage between local producer and last mile agent is another focus we have to give attention for, because the trust among those two actors is low because they don't know each other, and we need to work on that to build that market linkage and trust between those actors. And looking for raw material suppliers, if possible at the regional level, is also critical, because those suppliers at the capital city or at this level are not really close to the local producers, and accessing the raw materials is a big challenge for the local producers. So we need to find more raw material suppliers at this level, as well as at field office level, or regional level, so that there will be competition for a better price, so that the local producers can get the raw materials with less price. And promotion at community level using the local medias and any social medias is also quite important to increase the demand side at the community level. I think these are all what we have, and if you have any question, we'll address those questions. Thank you very much.
Great, thank you so much. Really appreciate the presentation. I see some questions have come into the Q&A. We'll try to answer those via written responses if you can, Ripa, as we wrap up. I want to go ahead and launch. We have an end of webinar poll. We'd love to get your feedback on today's webinar. Now, I also want to thank everyone. I know we're a couple minutes over on time, so I want to thank all of our presenters for joining us today, sharing your expertise. We'll be sharing out afterwards the different presentations, as well as some of the resources that our presenters spoke about today. And so just to say that this event is usually held every couple of months, and so please do watch this space to see when the Hygiene Promotion Technical Working Group has our next webinar in the next couple of months. We're always looking for presenters and ideas when it comes to hygiene promotion and ways that we can work together in the sector to strengthen our overall goals of improving hygiene and well-being. So thank you again. Thanks to all our presenters, and thanks to the 70 participants that joined us today. Have a great rest of your day.